Professor Woolhandler, Dr. Woolhandler, thanks so much for being with us. Assess Baucus's plan.
Baucus's plan is a complete sellout to the insurance industry. The counsel on the Finance Committee that oversaw the development of the bill is a former vice president of WellPoint, a major insurer, and the insurance company's interests are protected in the bill, but the interests of the American people really aren't. At best, this bill is going to leave 25 million Americans with no health insurance, and our study indicates that about 25,000 will die annually as a result. Really, what Baucus is doing is protecting the profits of the private health insurance industry and sacrificing American lives.
What about the affordability issue that's been raised by some critics, or began to be raised as soon as the announcement came out?
Well, the way to afford universal health care is to go to Medicare for All, also known as single payer, also known as nonprofit national health insurance. That's the way every other developed nation achieved universal health care. They spend less than we do. In fact, the average for other developed nations is about half the per capita cost of health care that we have. People in Canada and Western Europe live longer. They don't have to worry about having medical bankruptcies because their health insurance didn't pay for things. So the nonprofit Medicare for All approach is the only affordable way to cover all Americans. Of course, the insurance industry hates it, and when you put an insurance industry vice president in charge of writing a bill, you shouldn't be surprised to see that the insurance industry profits are protected, but American lives are sacrificed.
Explain what you mean by insurance industry vice president.
Well, there's a woman named Liz Fowler, who is the senior counsel for the Judiciary Committee, and her charge was to lead the effort to design this bill. But it's not just her, it's the millions of dollars in donations that Baucus and other politicians have accepted, the millions of dollars in donations from the insurance industry to President Obama. It's President Obama's decision from the get-go to play ball with the insurance industry, to compromise with the insurance industry, to involve them in the process. And of course, you give them an inch, they take a mile, and what's left of this bill is a dream for the insurance industry. The individual mandate creates millions of mandatory new customers. Uninsured people are being told, you're the problem, we're going to fine you up to $3,800. We're going to give you a fine, a penalty, because you're uninsured and you don't have health insurance. The individual mandate is a complete misunderstanding where the responsibility for this is. This problem is not caused by the uninsured themselves. It's caused by the health insurance industry, and our Congress and Senate needs to confront the health insurance industry, say we're going with Medicare for all. There's absolutely no reason to have a private health insurance industry. They add no value, they add a lot of costs, and those costs are so high that it means we cannot get to universal coverage with the insurance industry in the middle of things.
Now, you have an individual mandate there in Massachusetts under the Massachusetts plan. How has that worked?
Well, it hasn't worked very well. When the individual mandate was rolled out this past year, we saw no improvement in the number of uninsured in the state. We actually saw a deterioration in access to care. The previous year, they had rolled out a Medicaid expansion. That worked. That got some people covered. But when they rolled out the mandate this year, there was no improvement in the number of uninsured. The Census Bureau just announced that only half of the uninsured were covered by that Medicaid expansion. It also found that there were 5.5% of people in the state uninsured. That's not universal coverage. And then our private insurance industry just announced that they're raising all of our premiums 10%, and they're saying that's because of the cost of the reform. So in Massachusetts, we've spent a lot of money. We've managed to cover about half of the uninsured through Medicaid expansion of Medicaid-like programs. We've given the insurance industry absolutely everything they wanted, and what we're getting is higher prices and still having uninsured people in the state.
Dr. Woolhandler, this report you just came out with, 45,000 people a year die from lack of health insurance. Where are these numbers coming from?
Well, this was a federal study done by the CDC. They collected the data. Of course, we analyzed it. They collected the data. They interviewed thousands of people and also had them examined by a physician and gave them lab tests. So we have very detailed information, not only about socioeconomic factors like education and income, but also their baseline health. How healthy were they at the beginning? Some were uninsured, and then the CDC followed these people for up to 12 years to see who lived and who died. So we were able to see what was the effect of lacking insurance on death rates, and found that, in fact, people with no health insurance had a 40% higher death rate than similar people who had insurance. So this actually, when you do out the numbers, this implies that for every million people who remain uninsured in this country, about 1,000 deaths can be expected. So perhaps Senator Baucus is happy with leaving 25 million Americans uninsured, but that translates into predictably 25,000 American deaths each year due to the lack of health insurance. And that's completely unacceptable to me as a physician, and it's completely unacceptable to the other 17,000 physicians who've joined me in Physicians for a National Health Program to advocate for Medicare for all, single-payer national health insurance.
Dr. Woolhandler, there have been numerous reports now about the enormous expenditures that are being made by the health insurance industry and by other businesses in America around health insurance. Something like $260 million in the first 6 months of this year on lobbying, another $20 million in direct political contributions. I think the U.S. Chamber of Commerce is in the lead. $26 million spent on lobbying in the first 6 months of this year. What's been the impact of that on all of the various bills that are being shaped through the House and the Senate? And where are the public health advocates in terms of being able to be at the table, as President Obama promised initially that everyone would be at the table?
Well, I think, to quote Bob Dylan, money in politics doesn't talk, it swears. And in fact, the reason we're getting such a bad bill that's expensive, that doesn't cover people, is because of the insurance industry money and influence. I have to add that the pharmaceutical industry is planning to spend $150 million advertising in support of this bill. What we need is a single-payer approach that would save between $300 and $400 billion annually by administrative simplification, by getting rid of the billing paperwork. You save $300 to $400 billion annually, and you use that money to cover the uninsured, but also to plug the gaps in the coverage of people who now have insurance, usually private insurance, that's full of gaps like co-payments, deductibles, uncovered services, that mean you can be insured, you can have private insurance, and still, if you get a serious illness, find yourself facing bankruptcy. We need to get rid of the insurance industry, take that administrative savings and use it in a Medicare for all plan that would cover all medically necessary services. And obviously, the insurance industry hates that. They have been quoted as saying, we're opposed to single-payer national health insurance. It's a life or death struggle for us. But, you know, this is still a democracy, and we need to be holding our representatives' feet to the fire on this. There's lots of opportunities in the next month to take a stand for single-payer. For the first time in history, there are bills in the House and the Senate, the Sanders bill in the Senate, the Kucinich-Conyers bill in the House of Representatives. There's two very important amendments. There's a substitution amendment by New York Representative Anthony Weiner to substitute single-payer language for the entire House bill. Nancy Pelosi has promised him a vote. There's also the Kucinich Amendment, which would allow state opt-out. We think it's extremely, state opt-out and to try some single-payer plans. So we think it's extremely important for the viewers to get active right now, to be calling those senators and congressmen and telling them to vote for single-payer, to vote for the Weiner Amendment, to be signing on to the bills in the House and the Senate. People need to be writing to the newspaper. They need to be calling talk shows. This is the time to be saying that the American people deserve Medicare for all, and that the Baucus bill and, frankly, the House bill, which would leave 17 million uninsured, those are just unacceptable, that we do need Medicare for all, not just to save the lives of the uninsured, but to make sure that people with insurance can afford health care when they get sick.
What about the issue of the public option? You've been